Again, I'm going to just welcome everybody and thank you for being here today and kick off with a few announcements and reminders. We're here today for this Immersa webinar, Writing for Change, How to Sharpen Your Persuasive Writing Skills and Effectively Use the Pen as an Advocacy Tool. And it's really an honor to be able to be the moderator for today's session. I'm joined by Ben Orton-Vipond, who will introduce himself, as well as Zach Siegel, who will also introduce himself. And Adam Gordon will be joining us shortly. He may have gotten slightly hung up, but I think Adam is another panelist and he'll be joining us, I anticipate. And if not, we'll have plenty to talk about with the three of us. Just a few ground rules, which is if you are able to turn on your video, we love to be able to see who's here. It's also fine if you can't, and it's the lunch hour for many folks. If folks, just a reminder to mute your mic when you're not speaking. And the Richard Sates rule, many of you are familiar with that, but just in case, when you are asking a question or speaking, if you can state your name, your role, and where you work, and ask a question and keep it focused, that would be great. We have an ambitious agenda. Leslie Swen is our timekeeper and will be helping keep us moving forward. So if I'm redirecting, it's not because there's not a lot of interesting things going on, but just to keep us moving forward. And with that, we're going to jump in. The last thing before we jump in is that this is part 1 of 2. So all participants are invited to attend an Immersa office hours writing session with Zach Siegel. That's a part 2 for this. It should be great. It's on October 22nd, which is a Wednesday at 1 p.m. Eastern, and we'll make sure everybody gets the link for that. So with that, I will ask our panelists to really briefly introduce yourselves, and I'll hand to Zach if you would kick us off.
Sure. Thank you so much, Honora, for kicking us off, and thanks everyone for being here on a Tuesday afternoon. My name is Zach Siegel. I'm a journalist, writer, and editor. I've been covering, drug policy, the overdose crisis, addiction medicine, politics for a wide range of news outlets going on a decade. For some references, I've written about deep brain stimulation in Harper's and why police officers think they're overdosing on fentanyl in the New York Times, and Hollywood and addiction dramas in this new genre we're kind of seeing out there. So I've covered this subject from every angle I could imagine. So there's a lot of experience. I'm happy to discuss pitching and working with editors and thinking about just the craft of writing. So I'll stop it there for now, and excited to be here.
Thank you, Zach. Ben, go ahead and introduce yourself if you would.
Hi, everyone. It's great to be here. My name is Ben Orton-Vipond, and I'm the Communications Director for the Overdose Prevention Program at the Global Health Advocacy Incubator. So we're a nonprofit initiative that advocates for advancing smart public health policies around the world. And in the US, we focus on advancing those policies that take a public health approach to overdose prevention. So in that role, I work with my team members to craft messages and arguments to convince federal policymakers to take those smart public health steps and move smart policy forward.
Thanks, Ben. And Adam.
I'm here. Hi, Honora, and nice to see everybody. I'm Adam Gordon. I'm a professor of medicine and psychiatry here at the University of Utah. I'm editor-in-chief of the journal Substance Use and Addiction Journal, as well as have been part of many editorial boards. As an author, I do a lot of advocacy pieces, and both in the lay press as well as in scientific writing, and really looking forward to having a good conversation today. Thank you.
Terrific. I should introduce myself. I'm Honora Englander. I'm a professor of medicine at Oregon Health and Science University in the peaceful, beautiful, tranquil Portland, Oregon. I lead efforts around hospital-based addiction care and changing hospital systems, both sort of locally, regionally, and nationally. I'm a reminder that advocacy can mean a lot of different things. I think we think about advocacy often in the political sphere in terms of policy. It's critically important, we can also think about advocacy really at a local or institutional level. I'm going to really briefly sort of just set up an outline for how we're going to weave our conversation today. I'm also seeing a few things pop up that give me one other reminder, which is we will be recording today's session, but we're asking that folks don't sort of personally record it, and we don't have any AI chatbots, in the room. And if we do, please boot them out. I don't exactly, I'm a Luddite. Okay, so with that, for the writing roadmap today, in our preparation for today's session, one of the things that sort of emerged of really how to think about writing for change was this roadmap. And the first step of which is really to sort of think about sharpening your message. What is your message? How do you break through the noise? Who is your audience? So we're going to talk about that. The next step that emerged was thinking about making a pitch. And I think there's some really, I'm so grateful to Zach and Ben, who have really different perspectives than many of us in academia around how to think about that, and some really practical sort of tips of the trade there. Next, we'll talk about crafting the article and how to really sort of tell your story in the most effective way. And the last step of this writing roadmap that we're not going to touch on due to time is thinking about kind of more of the dissemination phase. We plan to have question and answer at the end. And as I said earlier, there will be a follow-up office hours, but feel free to please put your questions in the chat and we'll do our best to get to them. So with that, I'll kick us off, and I'm going to start with a question for Dr. Gordon, for Adam, about this notion of sharpening your message. Many webinar participants are clinicians or researchers or researchers. And I'm curious kind of how do you as a journal editor think about framing research findings or clinical experiences so that they resonate with policy debates?
Thank you. It's an awesome question, and often a very complicated question and answer with this. In the scientific literature, it's really important to have some the context of who are your audience. So if you're writing to a scientific journal and advocating for something, you're going to have to think about the audience that's going to be looking at this, and not only what the audience wants to hear or wants to appreciate, but also what the editor or the journal want to present. And a good way to think about this is in kind of a three-step process. Number one, kind of thinking about the so what factor. So why is this important to a scientific audience? Why is the message that you're trying to sharpen? What can evidence come to bear to persuade the scientific audience or the lay audience that reads the paper of your point of view? The second is to be very, very careful. In the scientific world, oftentimes journal editors love to have debates. So a good argument is when you not only advocate for a certain position, but you also acknowledge the other position within the scientific article. You want to think about the evidence that may sway your side of the story, your position, but also the evidence that may sway against your position, and provide evidence on both sides of the story. And then the third thing, I think, the really important thing when you're thinking about the scientific audience or a scientific journal, when you're writing your article, is you want to think about what implications there may be. Oftentimes in the scientific literature, you're dealing with more healthcare issues, you're dealing with more disease-based models. A classic example would be maybe the utility of a urine drug screen would be a classic debate. So there's a lot of evidence on one side that this is a very useful tool. There may be contingency management, for example, that a urine drug screen or test is very important. But there may be other arguments and other evidence that says that, hey, maybe there's not much evidence to do random screens for patients with addiction or who are on opioids, et cetera. And so providing the scholarly evidence is really important here. So referencing an advocacy article or position paper is very important in an opinion piece, because then you're drawing upon not only your opinion and what you want to advocate, but you're also drawing on the historical evidence that's out there in the peer-reviewed literature. The last thing I'll just say in terms of a scientific editor here is that we love most editors love opinion pieces. They love to drive the debate and move the field forward. So when you are looking to publish a piece like that, you need to make sure that you're appealing to what the editor wants, and that is a well-referenced article, both sides of the debate or multiple sides of the debate, and also find the journal that actually takes these type of pieces. Not all scientific journals will accept opinion pieces from scholars. They may be from the editorial board or for their organization. So just make sure that you square that piece before you write it for a specific journal, that it's appropriate for that journal, and they do accept those pieces.
Thanks so much, Adam. Zach, I'm curious, or Ben actually, but Zach, you talked a little bit in our prep about sort of how you think about breaking through the noise, and I was hoping you could share that too.
Yeah, well, I think Dr. Gordon, Adam, kind of hit it right on point when like editors also in the lay press love a good debate, and like drug testing seems to like it's a perennial thing debated, and perhaps it's worth, kind of pointing at like things that are just kind of status quo, like fish to water kind of things, like pointing out like kind of the most obvious thing that's like right in front of your nose, like drug testing. Like, why do we still do it? Like I think those things do break through the noise because it's like even a layperson understands that drug testing in some way is part of treatment or a DUI, kind of probation, supervision. Like when you take a topic that is uh, like it is kind of dense and walky and has a lot of scientific scholarship and deep history behind it. But I think what breaks through the noise is something that is like just really in your face and out there, and people uh passingly like have opinions about it, and can like easily and legibly recognize the stakes. And I think that's an important thing to the topic here of like and I'm sure this is right in Ben's wheelhouse, is like how to appropriately frame and measure the stakes of what it is you're talking about. And it's hard to do. I think editors, especially in the lay press, they'll be like, how many people are they want like precise numbers, like how many people on buprenorphine are going to be threatened by Medicaid unwinding, like how many lives does that cost? And it's hard to find these numbers, and that's probably not an exact science, but you need, I think, like robust, kind of easy to digest numerical figures behind these things. Like that really helps, I think, break through the noise and offer something very clear and simple and digestible for people with dense and deep knowledge, and people who don't have that are just arriving at the subject. So I'll pass it off to Ben. I'm sure he's got something to pick up on there.
Yeah, I mean, I agree with what Adam and Zach both said. I think, in my experience, breaking through the noise also means just being specific and getting specific. So if there's a very broad discussion, and and sort of you maybe own or participate in the knowledge of one facet of that, get specific with a pitch or get specific with an op-ed and really explain, what's at stake and sort of and state your opinion. Um, what Zach said as well is sort of ringing out to me, about pointing to numbers and pointing to actual outcomes. And I say that because I think in health media and probably in media writ large right now, there are a million what if stories that could happen related to policy advocacy. What if this policy passes, then this could happen, or what if that policy passes, that could happen. And just anecdotally, what my team and I heard from a journalist recently is that her editors are very interested in actualities. They don't want to, post a bunch of articles, for lack of a better term, that are worrying. They want to demonstrate real outcomes, real threats, because they want their readers to understand what's actually happening in the public health space and in the overdose space. And so, my advice, and to riff off of what Zach said, is just, like I said, be specific, and then also deal in very near term consequences if you're sort of stating about negative consequences of a policy action.
And can you give an example of a sort of something that's more specific, less specific, just to make sure everybody's following?
Of course, yeah. So one of the issue areas that my program focuses on is extending Medicaid coverage in jails and prisons so that reentry programs can better offer MOUD programs. We know it's a really important issue. We know that a lot of folks are perhaps not using when they're behind bars. They reenter society, and those threats and triggers are all still there, and they're at a very heightened risk of dying from overdose. And so we know that treatment programs can lessen that risk quite significantly. And so for example, when my team's reading news or reading outlets, and we notice something that's maybe tangentially related or broader than that issue, we might write a response or pitch coverage of that specific topic. So specifically about treatment in jails and prisons, and winnow it down and make it feel it's a related story, but it is a different story. And so in that way, it might feel to some editors or journalists like, I don't think they want to repeat their articles over and over again. But if you give a more specific winnowed opinion or take, I think that's a one way to break through that noise that we're talking about.
Yeah, if I could add to I think the crafting of this, as you sharpen your message, again, you're looking at the different audiences. And when you're thinking about advocacy, the best way to do it is to keep it simple. Keep your message very simple, to the point, and hopefully it's actionable. So it's a little different writing than you're doing in a scientific journal versus when you're doing it within like a op-ed piece or a letter to the editor, et cetera. So those latter ones, you really need to be very specific. What are you advocating for? What are you doing? Don't just cry wolf. Be very clear. And I think that crafting that is really important as you sharpen your message for your opinions.
Thanks. That's terrific. I'm going to keep us moving to step 2. We will have time for Q&A. So, but, and just to kind of bring it together in terms of this idea of sharpening your message, really thinking about who's your audience, keeping it simple and actionable and specific. It seems like some of the key take homes there. Let's talk about making a pitch. Zach, you talked about your process making a pitch with certain pieces in our preparation, and it was really different than I think how most Immersa members may have been exposed to thinking about this sort of through mentoring and training. So I was hoping you could talk about what it means to you to make a pitch and how you go about it.
Yeah, I'll start off by saying, like, I've been approached a lot by medical professionals, healthcare providers, researchers, people in the field about, how they can write an op-ed or how they can get their take out there or raise their own kind of profile or how to get their point of view across. And what I see happen a lot is someone will send me as an example of, like, here's my 800-word op-ed that it's already written. It's how do I get this in front of an editor, or I'm going to send this to opinion@newyorktimes.com and cross my fingers. And very rarely, I think, is that going to be successful. Like, in my own experience, I have been much more effective at very specifically researching editors, what they cover. Like, every newspaper, this is kind of a dying concept, but they have mastheads. It lists the names of the editor-in-chief and the executive editor and the copy editor and the fact checkers, and everyone's name is who you would be working with at a news outlet or a paper. Their names are out there. They're very researchable. Every editor at a paper has a vertical, like there's a health and science editor at the Washington Post, for instance, or a book review editor or a, you name it. And so I tend to, locate the editor who would be most, yeah, I think aligned with what I'm trying to do. And so if there's an opinion editor who has edited a ton of pieces about addiction and mental health or neuroscience, like that's the person you want to reach out to. And I think rather than having your piece, like your 800-word op-ed fully developed and already written, I think pitching actually your idea in a very concise, like very well written couple of paragraphs to the editor as um, and what I think people get kind of tripped up about is like there's a difference between having an idea and having a pitch. And a pitch is a much more, I think, fully thought out explanation of here's like the big idea, here's a sample headline, and here's an introduction of what this piece will go over. And it needs to have certain elements and ingredients, like are there any people impacted, characters involved? What do these people want? What are they trying to do? There needs to be, action and conflict, and like Adam said at the very top, like if you're going to be taking one side of a debate, you should be able to argue the other side of your debate pretty well and know the positions against you even better than your opponents could do it sometimes. It really helps to kind of in the business, we call it like prosecute your story, like really poke all the holes in it you can, know exactly what the opponents of your position will think and say, and have a very solid retort to it because it will come up. So I think in a way, a pitch, it's almost harder to write than the 800-word fully realized thing, because once you try to kind of deconstruct everything, it's how could I really package what I want to say in a couple paragraphs to a very busy editor who is reading tens, dozens of pitches per day. So the competition, depending where you're trying to go, is steep, and we can talk about kind of how to decide now in this very weird and chaotic and fragmented media landscape. Do you want to go to the mainstream press like the New York Times or the Washington Post? Is your take better suited for a newsletter? Is it could it be a podcast interview? There's so many different ways now to kind of get out there, and I think it all just does start with having your pitch down and being able to take it to the right outlet. So I can kind of pause there, and we can keep picking back up on I said a lot of stuff.
No, that's terrific. I think this idea of and somebody had said the same thing in the comments about a pitch being different than an idea. And also, I think what I'm hearing you say is there's an anatomy to a pitch. I think many of us that have published in the peer-reviewed literature kind of understand the anatomy of a manuscript, but the anatomy of a pitch is as being something interactive and not fully formed and requiring certain elements. It's kind of like, oh, all of a sudden I started understanding things differently. That's really cool. Ben, do you have other things you want to say now about this piece? Because I think for those of us who are sort of more entrenched in the academic world, it's just great to hear your perspective too.
Sure, yeah. I love what Zach was saying. I think it's spot on. Understanding who the opinion editor is and who the health, vertical editor is. I think it's invaluable to folks who want to get their message across in some of these journals. I might also say too, I think that you know, I understand we're talking about creative writing. There could be a step ahead of when you have a fully formed pitch, which is just introducing yourself as a subject matter expert to some of these editors, um, doing something that we call a desk side. And it's, low stakes, just a meet and greet between you and an editor, you and a reporter at a certain publication that maybe you would love to be published in someday. It could be as easy as getting coffee or jumping on the phone for 15 minutes just to talk about your experience and why they should consider you an important voice in this debate. So in addition to what Zach said, I might also just suggest taking that approach if you sort of have something cooking but don't necessarily have an idea even or a pitch. Just make an introduction and then say hi. And I think an added benefit is that maybe those editors or those journalists will ask you for a quote. And that's sort of another roundabout way of getting your advocacy message across is if you're contacted for quote for a certain article around a subject like overdose prevention or addiction treatment, what have you.
Hmm. Can you give us an example? Just and I'm pushing really
Yeah,
for
no,
clarity
you're.
too.
I will give you an example, and it's because once I pitched Zach on a desk side, and it worked. So I will say, yeah, it's just, I think as you're settling in, to the folks on this call, as you're settling in and understanding what kind of mark you want to make, um, you know, take stock of the writers who have covered this before. Even as something as quickly as a Google search. Sometimes it's for me, it's just going to Google, searching the topic, going to news, and setting the parameters and seeing who's written on this. And um, that's a good as way as any without any sort of like um, high cost media monitoring tools to find out who's writing about this and sleuth around a little bit, find their email and say, hey, I'd love to introduce myself to you. This is my education background. This is what I research. Do you have 15 minutes to chat? And it might not work every time, and it might not work half the time, but I think it's a like I said, it's a low stakes way to introduce yourself to someone who might want to um, publish you in the future if it's an opinions editor, or quote you in the future if it's a journalist. And at least in my opinion, these desk sides aren't necessarily on the record. I don't think there's a threat of you slipping up too much. Don't exactly take my word for it, but that's just sort of in my experience. They're friendly, they're collegial. Everyone likes meeting new people, I think. So it can be as easy as that.
I,
That's
I,
great advice.
I just want to chime in with what Ben said is yeah, like that is a great way to get on the radar as like a step before doing a pitch and really getting your point of view out there, and just the kind of vibe and the style in media. It's like reporters and editors and journal, like we're just kind of chatty people. Like if you call us up, we answer our phones, we answer emails, like we are like that's our job. It's like it's not an imposition to be like, these days it's like, oh, you need to schedule a call, and like you can just like be, I think, maybe it sounds intrusive or imposing, but it's not. This is our job to talk to people, to meet new people, to hear people out, and that's really the kind of bread and butter of the business. We just kind of, yeah, we pick up our phones and we'll talk to anyone. That's kind of how it goes. So just, yeah, kind of don't be afraid to come off as what in other contexts could yeah be like yeah, just kind of like a bull in a china shop or intrusive in some way. It's not.
That's great.
Oh,
Adam, I'm curious what
totally
you
agree.
would
If I could, I'd just add that
say.
even academic scientific editors are warm and fuzzy people too. We are not scary people. In fact, I think our academic mission really comes through because we really are trying to mentor people, help authors out, help reviewers out. So, and I think even in the lay press, most journalists are really, really friendly and will help craft your piece and or tell you where to go for it. If I could add a couple things, I would say that if you're doing a lay press and you're going to like a newspaper article, don't discount your healthcare professional degrees, where you see patients, et cetera, because sometimes they really like the real world healthcare provider, not necessarily the scary professor coming from an ivory tower. So, don't feel shy about being proud of being a nurse or a social worker or a physician, because it can get you in the door for many of the lay press editors. And then the last thing I'll just mention on this segment, I will give you a way, an immediate way to get an opinion piece in a scientific journal. Here's how you do it. So let's imagine you're dealing with urine drug screens, right? And you happen to see a scientific article about a randomized trial about doing drug screens versus not doing drug screens. And you have a very firm opinion on that topic. Okay. Write a letter to the editor responding to the scientific article that someone wrote, because it does help. It contextualizes a debate that's now in the scientific literature. You're responding to an article in that journal, which then improves citations of that article. It creates a buzz, and you can, while you're responding or you're providing that letter to the editor, you are then providing some debate and context and interesting dilemmas that may come up, some health policy implications. Many very strong journals will actually have blogs where you can respond to articles, like JAMA does this, or New England Journal. You can respond online, and sometimes editors will see that and say, why don't you craft that quick paragraph that you put into the blog, put it as an article and as a letter to the editor. So don't be shy of that. The last thing
That's
to say is you want to look at, especially if you're dealing with health policy issues, look at the scope of the journal. And many of the journals will say, we are interested in health policy articles. They're more likely to publish debates and or health policy pieces. Thanks.
thanks. That's great. And I will just put in a plug for the upcoming Immersion national meeting. Having sat next to Adam at an oral research presentation and said, hey, I've got something I'm trying to get out there. And, Adam's able to say, sure, let me take a look. And we can, so even just to manifest that, I think sometimes when people have good ideas and you're not quite sure how to get it forward, talking to folks can be really beneficial.
Academic editors are very, very friendly in our space, addiction space. We actually help each other out on the editor side, even competing journals. And we will help you find a home for your article. We often suggest other journals that would be more appropriate than the ones that for ours.
Great. Thank you. All right, I'm going to move on to, so we've talked about sharpening the message, making the pitch, which is different from having a finished product that I am guilty of sending New York Times opinion, 800 word, very well crafted, but unfortunately rejected piece to sort of that step of making the pitch and then crafting the article. And I'm going to start with Ben, which has been drawing on your experience as a communications director. How do you think about crafting an advocacy piece and honing your message?
Yeah, of course. Thank you. So I think, in my experience, what I like to do first is just dial it back to that ultimate outcome, ultimate takeaway that I want to have happen from this piece. And in my line of work, it's often something I say as simple as, but it's really not so simple. A lawmaker signing on to co-sponsor a certain bill that we support. That is a very worthy outcome of an op-ed. And so I like to work backwards. If I like to think about what happens from this or where this op-ed is going, I dial it back and I make sure that call to action is clear, it's specific, it's actionable. I think that's, a key part of a call to action is that you can actually do something with it. And from there, I build out that argument. I support it with, if I have it, a personal anecdote, from whoever I'm collaborating with on this op-ed. I support it with numbers and research, but to a point that Adam made earlier, kind of translate it in a way that perhaps is less academic and a little bit more, general public opinion reader friendly. We don't want to lose any of the truth, and we don't want to lose any of the data, but we do want to make it accessible for those who don't have health backgrounds or those who don't have advanced educations, and just making sure that everyone can take something from this. There's sort of an old adage that's not just true of policy advocacy or communications, but I think communications writ large, and it's thinking bluff. So BLUF, bottom line up front, and that's something I really try to hold true in structuring these. in structuring an opinion piece or an advocacy piece or letter to the editor, what have you. So I think to me, that's the way to get that attention and to harness folks' attention, is just to make it clear and concise, what the point of this is. But then I think to build on what, Zach and Adam have also said, it's making sure that it's in the right place, addressing the right person at the right moment. And so that place could be something like the New York Times or the Washington Post. I'm also, Honora, guilty of sending the New York Times like 800-word op-eds and saying, "Oh, why wouldn't they want to publish this? Like, it's so good." Maybe they just didn't, maybe it didn't fit the timing. Um, so I think just thinking through, when you think through that ultimate outcome, try to match it to the outlet that makes the most sense. Is it a trade outlet? Is it something around health policy? If you're in your locality or in your area, is it your state newspaper, or is it you know, your city's, big newspaper? I think, as long as it's out there and as long as you have something to point to, I think, all those outlets are worthy locations for your thoughts and your opinions. Um,
Can you say more about that? Because I think the sort of and a little bit, this is my bad, but I sort of
no.
skipped over a little bit the piece of defining your audience.
Mhm.
I love the idea of really thinking about what is the action that you want to come from this. How do you sort of how do you think about that? Or sort
That's
of
a great question. So like I said, the work that I do is often to advance policy, and so that's how I think of who my audience is. It's a specific policymaker, or it's yeah, I mean, like I said, most often policymakers. But I think for the folks on this call, you might find that maybe there's not a law or a bill or an ordinance or what have you that's out there that's relevant to your research, but you still have this really critical piece that's so relevant to everything that's happening in the overdose crisis in the US right now. Um, and so certainly consider, rather than policy advancement like I do, thinking about awareness building. If use that op-ed to just raise the awareness among the general public, among your fellow clinicians, among fellow researchers. Um, and I think in that way, that kind of outcome and goal might lead you to your audience. And I'll give an example of some work that I did actually with a few MRSA clinicians. I was connected with two doctors from the Salt Lake City area who really wanted to advocate for broader methadone access, and recognize that their then senator, Senator Romney, was a decision maker on this. And so I and my team worked with them to craft an op-ed, think through where it was going, think through what it was saying. And ultimately, it got published in the Salt Lake Tribune, advocated pretty directly for Senator Romney to support this policy. And he ultimately did and voted for uh, now I'm blanking on what I know what the policy was. I know what the outcome would be. Pharmacy-based prescribing of methadone is what we were advocating for. And so, um, just that's sort of a case study that I like to think about in terms of, immersive members or other folks, who might be on this call, just thinking through what outcome you want, um, and thinking very precisely about that. So, it wasn't like passage of the bill. It wasn't, full scale, revamping of the way that the United States administers methadone. It was one senator expressing his view on one specific policy, and it worked. And I think it worked because of the specificity, because of the folks behind the op-ed and their sort of pedigrees and their lived and living experience of treating with methadone, and the outlet that it was in, that it was something that he and his team read daily, weekly, what have you.
Yeah, I will say, being a Salt Lake City person, that op-ed was very, very popular in the lay press. We got a lot of public comment on it, but more importantly, the academic world, the ivory tower of the University of Utah was very appreciative of those two scholars reaching out and to a different audience that they usually talk to. And so not only did it provide, public impact, it provided a research or a promotion impact. And in fact, a lot of promotion tenure committees are actually counting dissemination of your voice in lay press as much as it is for peer-reviewed journals. So just be aware that it's a very powerful medium, both in the public, but also in the research world.
Mm-hmm.
I would say that I'll just comment since I have the floor here. Think about telling a story. If you're talking that article brought to mind that you talked a story about, how people navigate into a system and how it could improve access. Tell a patient story if you can. Those are things that are very powerful. And I would try to, I don't want to say de-emphasize, but if you're a clinician, as I mentioned earlier, a clinician probably has more weight in the lay press than a researcher who talks about the New England Journal of Medicine article last week, right? That's not going to be impactful. That's not a story. And in fact, some people are, in today's society, it's whether academics are trustworthy for that matter. So tell a story of your experiences, and that really can define an op-ed piece really well.
Yeah, absolutely, Adam. Sorry,
No,
Honora.
no, you go ahead, Ben.
Yeah, to respond to that, I mean, both as a communicator, but also as just a reader, as someone who reads these, not just for the subject, I think there's something really gripping about something anecdotal and personal in those first two paragraphs of an op-ed, followed by the data and followed by what backs it and makes this a more universal experience than the one that you just outlined. So totally agree. I think getting personal with it right away hooks a reader and makes them want to read on. One thing I forgot to mention too, that's just really important when you're crafting your pieces, really do pay attention to the word count and what the outlet tells you they will publish, because they are like Zach has said, they're receiving so many of these all the time. If you're outside that word count or that character limit, it is tough to they basically it's tough to get in. So just pay attention to that right up front. Consider that when when you're writing your piece.
This is such a rich discussion, and I have to say one thing that strikes me in the story of your piece in the Salt Lake City Journal, I don't remember what the journal is called, is, Mike, for folks that don't know Mike Ince, Mike is a exceptionally strong writer. And he had the foresight to reach out to Ben for guidance on how to craft and message. And I think thinking about who else is sort of going to, I mean, maybe Ben, you could talk a little bit about that process too, of who else can sort of join you in crafting the message. I'm imagining that was part of what happened there.
It certainly was, yeah. I mean, we had the good fortune of being approached by Michael and him saying, "I want to write this. I want to talk about method and why it's important." Um, and yeah, I think in my experience, I'm working for an advocacy organization that's based out of DC, and so I'm not the best person to write an op-ed out of Santa Fe or out of Salt Lake City or in other parts of the country if I'm advocating directly to those lawmakers. And so, um, I mean, like you said, collaborating with either someone who is an advocate by trade if they work for an advocacy organization, or if you are an advocate, reaching out into that clinician world and finding someone who is passionate about this and wants to team up with you. I think it only strengthens the writing. I mean, Michael sent us something that was just fully baked from the get-go, and so it was hard to edit that because there wasn't much to edit. But I think those sort of disparate trades link up together and make a really strong piece together. And so you're totally right. Just find a good partner in it and put pen to paper and see what comes out.
That's great. I think I'll speak for myself as somebody in academia. I don't always think that people, like, I know that I have expertise, but I think sometimes it's hard to recognize that expertise can be an asset to other folks working on similar with similar goals. And so sort of seeing those connections is a really exciting opportunity.
One thing that just came to mind is, and I think Michael and Taylor did this on this article, is that remember we're all part of universities and academic medical centers, and they are becoming a little bit more risk averse in today's society. So there are some policies, whether you can speak on behalf of it as an individual or can you put your university affiliation on an article. You want to make sure that you at least clear it with a PR office, especially if you're going to the lay press in a local area. there have been some issues that I've heard about across the country where the university gets really upset because it's a policy potentially that they don't advocate for, but you're putting that name of that university on that byline. So just be very careful.
Good advice. We are at 1:40 or 12:45, 47 as a matter of fact, on West Coast time. So we're going to open it up for questions from folks. I have not been in the chat. I know journalists don't use doodle polls. That's crazy. Let's see. Do folks want to? Oh yeah, Megan, go ahead.
Thank
And
you.
if you
Hi,
could
I'm like waiting.
remember the same rule, please, and just say your name and your role and where you work.
Sure. My name's Megan Perry. I have a business that provides training and storytelling in this field and how to tell less stigmatizing and more dignified stories about people like myself. And I also design programs and interventions that are peer-based, community-based, arts-based. And I just had an essay published in Health Affairs in their opioids issue, and that's my first publication. It was in the narrative. I know, I didn't realize it was that big a deal, and then people keep going, "Oh my gosh, that's a really big deal."
It
Like,
is.
oh, cool. So I'm very, humbled and excited about that. But it's in the narrative matters section, and so my deepest skill set is that storytelling piece. I do not have an advanced degree. I do not have a research, clinical, academic, scientific, anything, nor do I have a writing. I have a theater education degree and a lot of lived and living experience. And so I find myself always put in the box of, oh, here's our token lived experience person. And I have way more to offer than that. And so my question is kind of, we hear always so much from the folks who've been trained to know things. And then there's a lot of us with lived experience who also know a lot of really valid things and can draw on more sources. And so any insight, advice, or pathways for a person like myself who is a skilled writer and storyteller, and to kind of cut through that box and get into the larger press. Like, I have an
Yeah,
emerging
that's a great.
podcast and presenting an like there's certain, in my own little bubbles, my voice is there, but outside of that.
Zach, I saw you
Yeah,
unmuted
yeah, I
too.
would love to chime in. Well, I think the fact that your piece in Health Affairs is out there, like you are breaking through, and that clip, having that clip, I think can really create some momentum. And when I started my career in like 2015, it was just a very different media environment where I was just tweeting stuff and editors would DM me and say, "Can you write this for me?" And so like that doesn't happen that much anymore. It still does, but like back in that day, like I just had a bachelor's degree. Like I wasn't a professional journalist or writer at the time. I was just like trying to get out there. And part of how I did it too, because I also have my own addiction experience from and my own history. Like I think the way to communicate and talk about this with editors is to, I think, just really be bold and send the emails to the editors beyond Health Affairs and in the lay press. I think after this I'd be happy to talk, and I know a ton of editors who yeah, they don't look at your resume. They do not care really about your history, and like they want to know like what's the last thing you wrote. Maybe like if you put that Health Affairs clip in there, that's a huge signal to them that you can write and that you can execute on your idea. And that's really all the those are the main things I feel like editors in journalism care about. Like they've never asked me where I went to school. They don't ask you about a resume. It's really about, do they trust you to do what you say you want to do? And if you have clips to back it up, that's great. So I think you're like well on your way to doing exactly what you want to do, which is awesome. Congratulations.
I will say from the scientific perspective, academic perspective, is that we are really, really trying to get more personal lived experience, narrative, opinions in academic medicine. Not just our journal, but a lot of journals are really looking for that voice. So again, if you have an article, a great example of how to do that is there's something published in a journal, do a letter editor to respond to it. Say, from a patient's perspective or from my perspective, this is why this article is important or is not important. And you'll be surprised. There's a lot more people, a lot more editors are much more favorable toward that in the scientific literature. The other thing I'll just mention is that I scan social media quite a bit, and if I see a person that's advocating for something that's interesting or novel or a good writer even in social media, well, I have approached people before and said, hey, would you consider publish a commentary or a letter to the editor? So get your name out there. That's the best way to do it, and people will find you, whether it be followers or strange editors that's behind desks all day. We'll find you.
That's great. We probably have time for another question if there's anybody with one. Kayla, do you want me to read your question, or do you want to unmute and say it?
Sure, yeah, I can unmute.
We gotcha.
Hi, I'm Kayla Curdy. I work in Arizona with Sonoran Prevention Works. I write like curriculums and conference presentations for a large variety of people, definitely a lot of clinicians, but a lot of just like general public. And yeah, I heard a lot of things that y'all mentioned that I can definitely apply to those settings, but I'm kind of just wondering if you had any more like specific thoughts on like writing and speaking in that format.
And just to make sure I understand, so sort of in a more of a training type conference, or just clarify. Sorry if I misunderstood or missed
Yeah,
it.
definitely. No, no worries. Yeah, so rather than just like a single, op-ed or a single article or a single persuasive piece, more of, yeah, like a, 2 hour either interactive or lecture style, just like a longer format, basically, rather than just a written one-time thing. Like we do, a 2-part series, sometimes 3-part series. So kind of just advice on how to like build, like build to that conclusion rather than just, one written thing, if that makes sense.
That sounds like a awesome kind of activity that you're doing, and I'm not sure if I can provide a lot of advice other than to be consistent. If you're out there and you're doing reporting on a conference or reporting on an issue, oftentimes the people build an audience over time by being consistent and staying on point and being very investigative in their approach, and take different sides, maybe even debates, etc. And when you were talking in this question, it just brings to mind there's a whole divide between the academic world and the community world. And it would be really cool, and I would love to talk to you about this, is to somehow have people that are not in academia just sit in an academic conference and just provide opinions about what the heck are these people doing. It's almost like a foreign language or a foreign culture. And I think one of our challenges in advocacy too is to bridge the divide between evidence, opinion, and what public cares about. And it's a hard thing to do because we're in different environments. So I think people like you who are bridging that divide are going to be very valuable in the future. And being consistent in your messaging is going to be really important.
Great. We are wrapping up the hour. I just want to take a moment to thank our panelists. This was a really rich discussion. I learned a ton. And on my to-do here is to summarize what we've talked about. I'm finding that a little bit daunting, but I'll do my very best, which is to say, we talked about kind of the early stages of sharpening your message. And within that, we talked about really sort of honing in on the so what, being persuasive on why this matters, thinking about both sides of a debate, backing up your points with data and actual outcomes. One of the things that I think comes through in a number of spaces is the importance of a simple message and an actionable message as we're advocating. When we talked about, after kind of sharpening the message, we talked about making a pitch. I think really stepping back from this idea of a finished product that we then deliver to the editor's desk, and instead thinking about an active process is really important. And in terms of kind of honing the message as we write, the bottom line up front, really again thinking about making it clear and actionable by whom. Also, some of the kind of accessibility pieces are so important. So we covered a lot. I learned a ton and I'm really grateful. I want to specifically also thank the Immersa Advocacy Committee, which this webinar was generated from. I want to thank Leslie Swen, Mike Insee, and Christy Goyer for leading it, leading the sort of development of this. And I have a couple of upcoming opportunities that I want to plug. The first is the Immersa Office Hours writing session with Zach Siegel, as I mentioned at the beginning. It's on October 22nd at 1 p.m. Eastern. For those attending the Immersa annual conference in Portland, there is a pre-conference advocacy workshop. It's on November 12th. It's going to be facilitated by the Legal Action Center. Registration is required, and it looks like it's going to be a really exciting session. There's also somebody put in the chat, it's not called a meet and greet, or maybe it is called a meet and greet, but it's kind of a meet and greet with the SAJ staff and just lots of great opportunities for networking coming up. And for us to all, I think it's a really compelling, important time to be using our voices, using our power, and coming together to make change. So again, thank you so much, everybody, for being here. And it's really a privilege to spend the hour with you.
Thanks, everybody.